Are you pre-diabetic or diabetic and suffer from peripheral neuropathy, the condition that causes, some of the weird sensations in your legs and feet? Or do you know someone that has these conditions? I want you to please share this video with them or tag them in the comments. It could literally change their life. So my name is Dr. Aaron Andrews. I'm a chiropractic neurologist at PC Medical Centers. Our medical center is the only integrated clinic between Memphis and St. Louis that offers medical care, chiropractic care, and rehab under the same roof. So we are really doing some amazing things and changing a lot of lives. So this video, like I mentioned, is about peripheral neuropathy. What is that? I want to talk a little bit about it first. It is a progressive degenerative condition. Okay, I'm going to say those terms quite a few times in this video. It's progressive and degenerative, and it involves the peripheral nerves. So what are those? So you have your brain and your spinal cord, and you have the nerves that come off of it, and those nerves go everywhere, to your skin, to your muscles, to your bones, your ligaments, your discs, and they make you move and they make you feel, okay? So this condition, when those nerves are injured or damaged, it causes a lot of important functions to stop. The communication between the nerves and your brain and spinal cord start to get fuzzy, like a broken wire, all right? And it can cause a lot of inappropriate signals and static and a lot of symptoms. Now these symptoms depend on the nerves involved or the severity of the condition. And also, age, lifestyle, smoking, overweight, and there's a lot of other factors that determine that. So these symptoms, they progress from weeks, months, years. Remember I said it's a progressive degenerative condition. Once this train is on the tracks, there's no stopping it, okay, or slowing it down until now. I'm going to get to that in a second. So a lot of the symptoms that you can have are numbness and tingling, burning, walking on ants or walking on glass. You can have clumsy or trouble walking, temperature changes, and then, unfortunately, ulcers and infections and amputations. So, like I said, it's progressive and it's degenerative. So the most common cause why I asked that question at the beginning is diabetes. Over 80 to 85% of all the peripheral neuropathy causes is because of prediabetes or diabetes. There are other causes, autoimmune disorders, nutritional deficiencies, and in our clinic, we rule those out. So peripheral neuropathy, diabetic peripheral neuropathy is a blood vessel and a nerve problem, okay? So if you look at that, the blood vessels start to get thin and they die, and then they go to the nerves, and then the nerves get damaged and they start to die. So it is a blood vessel problem and it is a nerve problem. And, unfortunately, most medical care out there doesn't really address that. It just addresses the symptoms and getting people to tolerate it and feel better. How many of y'all out there have been told, that's all we can do for it, or we've done as much as we can? I'm sorry. A lot of patients we see in our office have been told that, and there is a lot we can do, and that's what this video is for. So that's enough of the bad news. Let's get to the good news. So the good news, unlike your brain and spinal cord, your peripheral nerves, which I talked about, they can regrow and they can regenerate, but they need a couple things. They need fuel and they need activation, okay? The fuel part, they need blood. Remember I said the blood vessels are narrowed and destroyed, so they need to regrow blood vessels. They need blood, they need oxygen, they need nutrients and vitamins, and then they need to be stimulated and activated, okay? You need both of these to regrow these nerves, and you can regrow these nerves. Unfortunately, like I said, all the medicines out there do not address this. They don't regrow anything. They just help with the symptoms. So we are the only office in the area, as I mentioned earlier, in a 150 or 200 mile radius that treats peripheral neuropathy like we do. All right, we get great success, and now adding in our medical care and some of the really great things that we're doing, we're adding more tools to the toolbox, and we are just having amazing results with this. So we address those things. We provide all the fuel you need and all the activation you need right here. I'm sitting in our comfortable peripheral neuropathy station inside PC Medical Centers. So I just want to end with a couple little comments and some questions for you just to think about. So, I talked about this being a progressive degenerative condition. Once it gets going down those tracks, it's not stopping, all right? But we can slow it down and we can stop it, all right? But what a lot of people do is they don't do that. They ignore it, or they just take the medicine and they don't do what they should do. And that leads, unfortunately, to amputations. Well, 75%, research shows 75% of amputations are completely avoidable, okay? And bad news is when you have an amputation, whether it's a toe, a foot, a leg, you have a 75% chance of dying in the next 5 years. So there's a 75% mortality rate at 5 years for anyone that gets an amputation, which is higher than a lot of cancers. So if you look at it that way, if you have an amputation, you're more likely to die in the next 5 years than you are from some of these major cancers. So it's quicker, progressive, degenerative, okay? So we have to slow it down, and we can do that in this office. We're the only ones that can do that. It's really amazing. So just a couple questions for you. What is your big toe worth? What is your foot worth? What are a couple more years on this globe worth to you? What are being able to play with your kids and your grandkids more efficiently, or play golf, or improve your stability and get rid of the crazy discoloration in your legs and the numbness and tingling and the trouble sleeping? What is all that worth to you? Okay, it should be worth a lot, and we can take care of that at PC Medical Centers. So what we're offering is a free consult to come in and talk to me, Dr. Pursley, or our nurse practitioner Carrera, about your condition. We can then do an exam and find out where you're at, what kind of severity you're at, what stage you are in peripheral neuropathy, and we can talk to you about your options. So please take advantage of that. It's over $100 value. It's a free consult. Come in. Again, please share this, tag it with anybody you know that suffers from peripheral neuropathy. There's a ton of it out there. It's getting worse and worse. There is hope. There is stuff we can do for them. We see it all the time. So thank you very much for taking your time out of the day to watch these videos. Again, please share it. I appreciate it very much. Thank you.